Welcome back, class. It's Dr. Lindner. Let's take a look uh, at some additional structures of the brain, more of like supporting structures, right? We'll introduce in this next video. We'll talk about the meninges a little bit, and we'll introduce the little bit about blood supply, and then we'll talk a little bit about CSF flow or cerebral spinal fluid flow in the ventricles. Okay. Um, we'll generally introduce blood supply because blood supply and circulation is a topic that's covered in a lot more detail when we get into the cardiovascular system, but at least we'll do some introduction to it. We'll lay down some framework for you. So when we look at this cross section, what we can see is that there's some soft tissue layers here that are going to protect the brain. And the soft tissue layers are what we refer to as the meninges. That's soft tissue. And the meninges are the same exact meninges that protect the spinal cord, which are the dura mater, the arachnoid, and the pia mater. So from a soft tissue perspective, it's going to be those meninges and fluid. And when we talk about fluid, we are referring to cerebral spinal fluid. And then you can go back in your mind and say, okay, where have I heard CSF or cerebral spinal fluid? When we talked about the different types of cells within the neural system, there was the neuron, and there was also the neuroglial cells. And one of the neuroglial cells was called ependymal cells. And ependymal cells are going to line the chambers, or what's called ventricles. They're going to line the ventricles and produce cerebral spinal fluid. The other protective covering, which isn't really shown here, is going to be bone, right? The skull. We covered the skull when we did osteology. So you have this hard shell, the skull, the protective covering of the brain. But inside and surrounding the brain, we're going to have fluid that's contained to help buffer from any type of traumatic brain injuries. So there's going to be fluid that circulates all throughout the subarachnoid space in here, and we're going to have fluid that flows through here. Ventricles 1 and 2, ventricle 3, and ventricle 4. So within these chambers, these ventricles, ventricle 1 and 2 is known as the lateral ventricle. There's going to be cerebral spinal fluid that has to flow from these lateral ventricles and get into the third ventricle. And then from the third ventricle, it's got to find a way to get into the fourth ventricle. And then after the fourth ventricle, it exits and goes right down here through the center of, if we think back to the spinal cord, and we remember how you had like the butterfly, or you had that letter H in the middle, and right in the center, there was that hole. That center is called the central canal, and that's where CSF flows through. And it's flowing all through here. It comes out, goes right back up here, gets filtered and reabsorbed at the top where we have the arachnoid villi, and it comes back in, gets reabsorbed and filtered, and starts all over again, for this what's called sacro-occipital pumping mechanism of the CSF. What separates the two lateral ventricles from one another is what's called a septum pellucidum. That's a clear, lucent sheath that separates both of these ventricles from one another. In fact, when you peel the brain in half from a sagittal view or a lateral view, you can see the septum pellucidum pretty clearly. Okay. The dura mater has quite a few extensions. So the dura mater has lots of different extensions. One of them is called the falx cerebri. Another extension is called the tentorum cerebelli. Here's the falx cerebelli here. So these are all dura mater extensions. The falx cerebri, the tentorum cerebelli, the falx cerebelli, just extensions of dura mater. Besides the flow of CSF, we have the flow of blood to the brain and the drainage of blood from the brain. So the heart is going to sit here, and one of the branches that comes off the heart is this aortic arch. And somewhere off the aortic arch, we're going to have this brachiocephalic artery that comes up. And off of that, when you look at the word brachiocephalic, we see two words, brachio, which means arm, and cephalic, which means the head. So the brachiocephalic, there's a brachial portion that's going to come down, go down the arm, and then there's a cephalic portion that comes upward to feed the head. The two main branches that bring blood, oxygen, and glucose into the brain is the vertebral artery and the common carotid artery. The vertebral artery comes up and it goes through the transverse foramen of those cervical vertebrae. When you learned osteology, you learned that there was a vertebral body of a vertebra, there was a spinous process of a vertebra, there were transverse process of the vertebra. And in the TPs, or the transverse process, there were holes. Those holes were called transverse foramen. And through the transverse foramen is the vertebral arteries that go through them, bringing blood into the brain. The common carotid artery, anytime you hear the word common, it's safe to assume that anything with the word common tells us it's going to divide into two vessels. And that's true whether it's an artery or even a nerve. If a nerve has the word common or an artery has the word common, you can think to yourself it's going to split or fork into two other structures. The common carotid will divide into an internal carotid and an external carotid. So a little bit higher up, we see the internal carotid and we see the external carotid. Internal tells us it's going to bring blood and oxygen and nutrients into the brain. External means it's going to stay more superficial, perhaps going to your facial muscles. Once the oxygen and glucose and nutrients get into the brain, it helps it function. But once the oxygen is dumped, we have to find a way of getting the deoxygenated blood back into the heart. And that's where we use the jugular veins. So the vertebral arteries and the carotid arteries are going to bring blood flow into the brain. And the reason why we need that is because the brain or the neuron need oxygen, and the neuron also needs fuel, so it needs glucose in order to function. The brain is going to use about 20% of the body's oxygen supply. And if there's any interruption of the blood flow or any interruption of the oxygen supply, then it's going to result in some sort of weakening, some sort of weakness. Could be permanent damage or death to the brain cells. And the same thing can happen if you deprive it of glucose. Any type of glucose deficiency for short periods of time can result in mental confusion, can result in dizziness, convulsions, and even unconsciousness. So this is the blood supply to the brain. Right here is a main vessel coming off of the heart. That's called the aorta. This is the ascending aorta because it's going up. This is the arch of the aorta because it's an arc. And then it goes down. That's the descending aorta. So off of the ascending aorta, there's your brachiocephalic trunk coming off to the right side. This is the person's right. This is the person's left. So from that brachiocephalic, we can see that one of the main blood vessels coming off is going to be the vertebrals, and another is the common carotid. Whenever you hear the word common, we know it's going to divide into an external and an internal. This is the internal carotid coming upward. Okay. Now, notice that right here, deep in the brain, there is like this circle that's formed. And that circle that's formed is this continuum of circulation where if there's a blockage here, let's just say there's an occlusion here, we could still find a way of getting blood and oxygen into the brain through this vertebral, or it can come up through this vertebral, or it can come up through this carotid and can still find a way of getting it into the brain. This circle is what they call the circle of Willis. Circle of Willis. Now, if there's a blockage for a period of time, they call that a cerebrovascular accident, or they call it a stroke. Okay. Now, there's two different types of strokes that people can have. One of them is ischemic, which means there's a clot or a thrombosis, and the other is a hemorrhage, like the blood vessel ruptures. So whether there's a blockage or a clot, that will decrease the blood flow to where the blood was trying to get to in the brain, or whether there was weakness in the blood vessel, maybe the endothelium was weak and it ruptured, or there was a collagen disorder, some sort of immune or autoimmune condition against the individual's own tissues, and the blood vessel dissects or hemorrhages, that can also result in decreased blood flow to the given area where that blood was trying to go. Either way, there's the decrease of blood flow, and there's going to be decreased function. Now, many people will exhibit certain signs and symptoms of a stroke that's starting to happen. Typically, the person will complain of a headache, but it's not your typical headache. It's not like, oh, I woke up this morning, my head hurts, ouch. It's not like a little bit of a migraine. When that person says that they have a headache unlike anything they've ever had in their life, that's the type of headache that you take yourself to the hospital for. That's usually indicative of a stroke. A person knows a normal headache versus one that's unlike anything they ever had before. Okay. So if they have a headache unlike anything they had before, someone may go, well, I think I'm about to have a stroke. I'm told I should take an aspirin because that keeps my blood nice and thin. Well, that can help you if it's a blood clot, right? Then the blood is nice and thin and can go through the clotted, restricted area. But if it's due to a hemorrhage and you take aspirin, that can actually kill you because now you're losing blood and now you're taking aspirin or baby aspirin, which is a blood thinner, you'll bleed even more. So that's why I tell people if you're having those type of symptoms like numbness to the face, numbness to the lips, visual issues, balance issues, these are all indicators that the person may be in the process of having a stroke. Now, strokes don't happen immediately. People can be in the process of stroking out for weeks, and they could just have headache, a bad headache, a bad headache, a bad headache, or they slurred their words once and then they're fine. or they knew what they wanted to say, but the words weren't coming out. Those are like little indicators. And we're seeing this more and more in a higher and higher incident after COVID. And it's happened after COVID because of the virus itself is known to create thrombosis. The vaccine was known to do that, but so was the virus itself. We know many people that are very, very young that are having vascular events. They're younger people having strokes or heart attacks due to the increased risk of thrombosis. So whether they're my patients or anyone, when they go for their blood work, for their annual blood work, I always suggest getting their clotting factors checked. If you had the virus or if you were vaccinated and had the additional boosters, for sure, you'd want to get a lot of your clotting factors checked. Some of the biggies would be something called D-dimer. D-dimer, that's one of them. That's a biggie. And you can get your fibrinogen levels checked. Fibrinogen and D-dimers are pretty good, and they're good at detecting whether the person is in the process of clotting. Okay. So what are the risk factors of a person having a stroke? If the person has high blood pressure, if the person has high cholesterol, especially LDLs, low density lipoprotein, not HDLs. Having higher HDLs are actually pretty good. But if the LDLs are too high and these become damaged, that's a problem. These are usually the ones that result in atherosclerosis. If there's a history of heart disease, if you have high blood sugar, if you're a smoker, if you're obese, if you use alcohol, these are considered to be risk factors. Okay. If the person is having a clot or a clotting stroke and they take something called TPA, tissue plasminogen activator, within a few hours of the onset, that can certainly decrease permanent disability, right? Because wherever the decreased blood flow is going, if those neurons start to die, they're dead. They cannot regenerate. You can make new ones, but the ones that are damaged cannot be regenerated. Now, what's a TIA? A TIA is a transient ischemic attack, meaning it's not permanent, it's a temporary cerebral dysfunction caused by a decreased or impaired blood flow for a short period of time. This is when they get a little dizzy, they slur their speech, right? We've seen this probably trending on certain, whether it be YouTube or TikTok, right? Some of these videos of newscasters that start speaking and they make no sense. They're talking, they know what they want to say, they're reading the index card of what they're supposed to be saying, but it comes out like, what did they just say? These are people that are having transient ischemic attacks or could have been in the process of having a stroke. They get numbness, they get paralysis on side of the face, and they can certainly get visual issues. Okay. It persists for a few minutes, these symptoms, but they leave no long-term deficits. Typically treated by some sort of blood thinner, either aspirin, baby aspirin, or an anticoagulant. Anticoagulation, right? Coagulation means clotting, anti means against. There's lots of things that can thin the blood if people were wanting to be proactive. Garlic is a really good blood thinner. Resveratrol, which comes in red wine, is a very good blood thinner. Fish oils keep the blood nice and thin. Vitamin E keeps the blood nice and thin. And certain B vitamins, like niacin, can keep the blood nice and thin. Now, I wouldn't do all of those things, that's excessive, but just implementing some of those keeps your blood nice and thin and keeps it flowing very, very well. This is a view of the brain underneath, like an inferior view. And when you look at it from underneath, I just wanted to show you, here's the vertebral arteries coming up like this. And then as you get deeper in the brain, there's that circle, right there. That's the circle of Willis that you'll learn quite a bit about. Notice that there are arteries that come off and they feed the front of the brain. They come off and they feed the side of the brain. They feed the occipital part, the back of the brain. And they even come off and feed the cerebellum. Okay, and that's why when you have a blood clot or a thrombosis or a piece of fragmented calcium that sloughs off an artery, it's not really much of a problem where the arteries are big. It's where the arteries get very, very narrow and small. That's where the clotting factor or that thrombosis, if it moves, gets stuck. So if it gets stuck to the cerebrum on the left side of the brain, that's your speech center. That's going to affect your ability to speak and communicate. If it gets blocked to the cerebellum, this can result in balance issues and coordination issues. We know that there is a blood-brain barrier, and that's going to protect brain cells from pathogens or toxic substances. It's designed to prevent the passage of toxic substances into the brain. Okay, but alcohol can cross that barrier. Alcohol can get into the brain. And they try and use this blood-brain barrier, they try and use it to try and influence and get certain drugs and medications into the brain, especially to try and treat certain types of cancer. It's really hard to get chemo into the brain unless they try and introduce it with a high sugary concentration, because glucose can get into the brain, right? But the blood-brain barrier itself is designed to prevent entry of things into the brain, right? Because although we know from an educated standpoint that trying to get certain medications or drugs into the brain could be helpful, but the brain says, hey, I'm the most important organ. I don't want anything toxic in there. Okay. Injury to the brain can cause a breakdown of the blood-brain barrier, and that can permit the passage of things that are normally restricted to get into the brain tissue. Okay, we'll pause here, and then when we come back, we will get into the flow of cerebral spinal fluid.